Welcome to one more edition of Politics Done Right. I'm Egberto Willis, your host. Thank you so kindly for being a part of the show. We are going to have a great show for you today. Dr. Wilcox, Dr. David Wilcox, is a doctorate-prepared nurse who also holds a master's in health administration and is board certified in nursing informatics. Dr. Wilcox has 28 years of healthcare experience in which he worked as a bedside nurse, hospital administrator, and in healthcare information technology, which has helped him to develop his unique perspective on the American healthcare system. Dr. Wilcox is the author of the book, How to Avoid Being a Victim of the American Healthcare System, a Patient's Handbook for Survival. Dr. Wilcox, welcome to Politics Done Right.
Thank you. I'm glad to be here. Thank you for having me today. And let's talk about the American healthcare system.
Well, you know, I have a lot to say, but it's, you know, today's you, brother. Today is you. I want to hear what you have to say, because one of the things I like to do whenever we're talking about something as healthcare is to learn what other people think, what other ideas people have, because that is the only way we're going to ultimately come out with the right solution. And the title of your book is intriguing. So let's go ahead first. Tell us a little bit about yourself before we get started.
Sure. So I have a special needs daughter that I took care of many years ago. And that is why I became a nurse in the first place. So I'm kind of like a homegrown nurse. I started out as a licensed practical nurse. Then I went back and got my degrees, and I became an overachiever and finally landed with my doctorate in nursing. But I remember the caregivers that took care of my daughter. And I thought, when I was working in manufacturing, when I got laid off, I had tuition benefits. And I thought, you know, I want to get into healthcare. I want to do something that really matters. I don't want to be making plastic parts. You know, I want to do something that really matters. And so that's what I did.
Now, that is great. Now, you said that you had a daughter that needed quite a bit of attention, quite a bit of healthcare. How did you find interfacing with the healthcare system, whether it's I imagine if she was probably on disability insurance, or was she on private insurance?
No, she was on disability insurance. Yep.
Right. I imagine then, that was a lot. How did you find the interfacing with the insurance?
Oh, the insurance was tough. It was tough to get it. And because it was Medicaid, once we got it, they pretty much covered a lot of stuff.
So, are you in Texas?
No, I was in New York State at the time.
Gotcha.
Now I live outside of Charlotte, North Carolina.
Okay.
But yeah, it was crazy. Back then, you're talking back 30 years ago. So, right. I mean, it was a whole different story than what it is now with the insurance companies. So we didn't have the Obamacare. Insurance companies could hand select people, right? And say, you don't get insurance because you've got a pre-existing condition. Or if you want insurance, you've got to pay through the roof to be able to get it because you have a pre-existing condition. They weren't doing that back then.
Well, amazing. Anyhow, so you wrote this book, How to Avoid Being a Victim of American Healthcare System. The fact of the matter is most people are, in fact, victims of this, what I call wealth transfer engine. So why don't you start telling me a little bit about why you wrote the book and some of the techniques that you found helpful to people based on your experience?
Sure. So, the reason why I wrote the book was I was finishing up my doctorate degree, and I thought to myself, what do I want to do with all this information that I have? I definitely didn't want my boss's job. I didn't want her boss's job. So, I thought, what am I going to do? And then the thought came to me, why don't you break down the complexities? Because healthcare is complex for a reason. It's complex because the entities that are buying for your healthcare dollars, my healthcare dollars, they don't really want you to know what's going on underneath the sheets, under the blankets in healthcare. So I thought, why don't I just break that down and write a book and explain to the American people in layperson's terms how to navigate, how to stay safe in a hospital. What do you do when you get that insurance company letter that says you're denied, your claim was denied? What do you do when you go to the pharmacy and find out your prescription drug medication is going to cost you your entire week's grocery budget? What are some of those tips and tricks? How do you navigate it? So that's why I wrote the book. And, it's interesting because of the feedback that I've been getting from people who have actually read it. So I have a neighbor who was going for surgery. And he told me, he said he went in to talk to the surgeon after reading the chapter on what do you ask a surgeon? And when he went in, he said to the doctor, he said, okay, so I have a couple questions for you. And he said, shoot. And he said, first of all, you're going to be the one doing the surgery, because a lot of people don't know in teaching hospitals. So you're paying a surgeon to do it, but it's an intern or a resident doing your surgery, right? And you have no idea that that's going on. So the first question is, are you going to do my surgery? The second one is, am I going to be your first case of the day? Because statistically, you'll do better if you're the first case of the day when the surgeon comes in refreshed, as long as he hasn't been on call the night before. And that's what you want to ask him. Are you on call the night before? So he had a whole laundry list of questions to ask this guy. And he said, when he got done, surgeon looked at him and said, I don't know who you're talking to, but those were some great questions. And so he came back and told me, he said, you know, this was my experience at the surgeon's office, and thank you for writing that book. So, and there's all kinds of tips, like looking at your hospital for star ratings. So you can go out to the Centers of Medicare and Medicaid Services, and you can actually see what your local hospital star rating is on 1 to 5, 1 being the worst, 5 being the best. And I would recommend that you don't, if you have the choice, don't go to a hospital that's less than 4 stars. You can also rate your doctor. You can also find out what his star ratings are. You can ask who your anesthesiologist is going to be and check out their star rating. So there's a lot of tips and tricks in this book that the general public really doesn't know. Oh, I lost.
Let me go ahead and ask you it this way. So we don't want you to give away, but because I mean, first of all, we couldn't cover that in 20 minutes. But what are the what can I expect to get out of your book other than let's say talk to your surgeon, shop around for a hospital, look about ratings? Are you going to walk folks through how to do that? Because I'm going to tell you something. It is not. First of all, you have a great book, and for those who are going to, you know, sometimes you have to know what you don't know and learn how to get to know it. And both of them requires a certain amount of skill. And I imagine one of the reasons that you are here as well is to point to people, hey, there is knowledge out there for you to use.
That's
knowledge
correct.
out there for you to get, because most people don't know it. How else can you hold their hands to say, get my book for this additional reason?
Sure. So there's a couple things that come to mind. One is a website called healthcarebluebook.com. So if you call your hospital or go on our website to find out what a total knee is going to cost, more often than not, even though there's legislation that's been in place since January 1 of 2020, they're supposed to give you the pricing, but if you go out there, it's usually a medical code. And I mean, I did it at my local hospital. I would have needed a medical coder, and I'm a doctor, prepared nurse. So healthcarebluebook.com will actually price out what a total knee will cost in your area. Then you'll learn things like, if you're in good shape, like we are, you can go to an ambulatory surgical center and get that operation done for about $8,000 in my area. But if you go to a hospital, it's going to cost you $12,000. So if you have if you have a very high deductible, you really want to pay attention to that, right? You want to make sure that you're getting pricing, because the hospital's not really going to be as transparent as they should be with you. And I could go on for days about, you know, when do you pick up a loaf of bread at the store, go to the register and find out it's going to cost you $20 after you've eaten half of it, right? Because that's what healthcare, that's the model of healthcare. The other thing that people really need to understand about healthcare is it's fundamentally flawed. So in the fee-for-service system, which is what we have right now, the doctor
explain what that means, because you know, that's a term that people use all the time, but I don't think people quite understand. You know, I'm an engineer, right? And if our bridge falls, we pay a penalty for it. If we don't provide a service or something, but that's not how the healthcare system works. If you go in there and you die, you still owe the bill, and your estate pays it.
Yeah, that's right. So fee for service is basically, they get paid on volume. They get paid on the amount of patients they see. So have you ever gone to the doctor's office? He spends like maybe 5 minutes with you, turns you back over to the nurse to ask questions, and then he's off, because he's getting paid, and I could break it all into medical terms, but we won't do that. He's getting paid on how many people he sees during the day. Same thing in the emergency department or at the hospital. So if you show up and you're sick, you're making them money. So what we saw during COVID, when people had elective surgeries such as total knees or things like that, they didn't go to the hospital. So what happened? We, the taxpayers, had to bail them out to keep the doors open, right? So this fee-for-service system is incentivized. It's incentivized to make more money for the providers and the hospitals. What people don't know, or only 25% of Americans really know about this, is there is a new model out there called value-based care. Value-based care gets paid on outcomes, on how well the patient does, as opposed to walking in and being sick and being treated retroactively for an illness that you have. Value-based care means that the insurance company is going to pay a certain amount for me, and my doctor is supposed to keep me healthy and out of the hospital. And if he does, he gets to keep the profit, as opposed to showing up sick and then making a lot of money off of me. So I get incentivized. They do things like they track my steps, you know, my tracker here. I can monitor my food intake if I want to, but they're incentivized. They're going to push out notifications to me. You need to come in and get your flu shot. You know, you need to get your colonoscopy. Yeah, because if something goes wrong with me, then they're on the hook for the rest of the money. And that is going to fix healthcare in this country if we can just move the legislators out of the way so that we can do this. It's already during COVID, we saved $4.1 billion in the value-based care system because they got paid whether you showed up or not. It was a capitated model. They got paid whether you showed up or not. Fee for service, we were bailing them out left and right? With taxpayer dollars, keep the doors open. So that's one of the things you're going to understand. And the other piece of it is how to use technology in that situation. So if somebody has congestive heart failure, which means your heart doesn't pump enough blood, and they're at home, usually what happens is the person, they don't walk as many steps. They're a little short of breath, don't really feel right. Maybe I'm coming down with a cold, I don't know. And then by the time it becomes a full-blown crisis, they're in the emergency department, which is a big old money generator for the hospital and for the doctors. And you don't get the benefit of having the proactive care. What happens in value-based care is your tracker goes up to a cloud. You have a wireless blood pressure cuff, right? You have a wireless scale so they can see if you're gaining weight. And then that all gets fed up and it bubbles up to the top of somebody's list, usually a nurse navigator position, who comes back and says, oh, Mr. Wilcox, Dr. Wilcox, you need to come in and see us, or we're going to adjust your Lasix. It looks like you're not walking as much anymore. Your oxygen saturation rates are down. And so they're incentivized, right, to keep me from going into that full-blown crisis in the emergency department. So it's a win-win. It's better quality of care for the patient. It's increased awareness for the physician group. They're incentivized to keep you healthy. So it's really quite amazing that what this value-based care model is doing for us.
No, I think that would be orders of magnitude better than what we have today. What makes you believe, however, that the way our corporatocracy runs, that they will find any reason to want to have a system of that sort?
Well, there's already systems of that sort out there, and there's data that shows that they work. In fact, in just the recent $5.1 billion, or was it trillion or $1 billion bill that just went out, there was they wanted to put a value-based care act into that to incentivize more clinicians to do it, because I mean, your clinicians are going at risk. They're not used to that. They're used to getting paid when you show up. So all of a sudden, if they have to keep you healthy and they get a certain locked-in amount, they want to know that they can keep you in their network, right? They don't want you to go outside of their network where it's going to cost them more money. And in network means you're going to go see the doctors that are all underneath this plan, because it's a group of doctors who share that capitated amount. So they're a little, they're a little afraid to make that jump into value-based care, but the doctors who are doing it and doing it correctly have the data to show it can be done. But they didn't improve that act in that bill. So
no,
we were hoping they would.
You are ingrained into the current system, and I see the absolute value in your book in how can you navigate the current system as is, which I think it's essential, right? Unfortunately, for most people who are not going to get your book, for most people who don't have who don't know what they don't know, and who just, most Americans throw their hands up in the air and say, look at what they're charging me. Look at what they're doing for gasoline. Gasoline is $5 a gallon, even though we have a surplus of oil that nobody talks about. It's like quiet. Venezuela is swimming on oil and we just don't allow them to pump. We can do a whole lot of things. Like we can talk a whole, so most Americans don't know things. Now I want to challenge you, however, in one respect, and that is, I understand that you are a creature of the system, which is and that you are able to tell us how to navigate it successfully. You've also told us about a value system that I much prefer, and I think it's more humane. In other words, it actually says to you, hey, go ahead and we treat the whole body and make sure you don't get sick. That's a great thing. I want to challenge you in one respect. That still has that profit motive in there that, to me, and you can correct me if I'm wrong, still says that there's a potential that I may not want you in my group because you may actually skew the numbers if you have that, even within that value-based system.
Sure.
That's what I see in, I see the value system as humane, but I also see that given that it has a profit motive, and there's nothing wrong with a profit, that's, but in healthcare, I really cannot fathom having the motive in there. Convince me that I'm wrong.
So let's explore that a little bit. So other countries, now we went up from 17.6 of our GDP to 19.7 in 2020. Most countries pay about 8.7 of their GDP. As far as healthcare quality outcomes, we are dead last in industrialized.
OECD, yeah.
Yes. So they're doing some things that are working. It's not perfect, right? Within the government being able to negotiate prices, okay? So they can negotiate, if they're taking in a bunch of low pressure or a drug, they can negotiate it for the entire population of, let's say, Finland. They can negotiate that price. With Medicare, we're not allowed to negotiate the price.
Exactly.
Right. There's a bill in place that says you can't negotiate it. Now they're doing some work on that. Hopefully we can negotiate drugs that meet a certain criteria, like greater than 5 years old. But that's crazy, right? So we have this unregulated pharmaceutical company, and everybody thinks they make big money off these brand name drugs when they come out of the gate and charge way too much for them. It's the ones they're not talking about. The curve goes up over inflation, and that's how they're pocketing the money. And they're making their shareholders 15 to 25% a quarter, right? So yeah, the profit margin. So this country will never, and this is my opinion, will never go to socialized medicine. It just won't happen.
Well, let me stop you there and ask you a question though. You've
Sure.
been in the system, and you don't have to answer that, but isn't that model really the most efficient model of them all?
It depends. So there are some efficiencies that are gained, such as price negotiation. But you see what happens in Canada, right? Canada, it's hard to get an appointment. All the doctors leave during the summer because they can, and so you'll get the junior players there. There are some aspects of it that work right and some that don't. But the closest thing that we're ever going to get to, I think, is going to be an incentivized model in which the actual physicians, the respiratory therapists, the dietitians, the nurses, they all have skin in the game and get paid to keep you healthy. I think that's the model that we're going to see. This value-based care model is the model. And I know you alluded to the fact that you don't like the profit aspect of it.
Yeah, I'm going to go into that a little bit more later. But I mean, yeah, I don't. Sure. I don't think it's moral. But please finish for me.
Yeah. So, but if you're working to get your profit, because in a fee for service, you're not. You're seeing them come in, you're making your notes, you're getting paid, the coders are going through, pulling stuff out. That's a whole nother nightmare. And that's another thing they gain in socialized medicine. Like they might have 7 coders for the entire country of Canada. We probably have like 350,000 here in the States. So that increased the cost, right? So they're actually working. My point is they're working for that money because they're part of your healthcare team. You are partnering with them as opposed to being treated by them. There's a big difference when I partner with my providers as opposed to being treated. So then I have some accountability. If I'm going to go to Wendy's every day and get a burger for lunch, or if I'm going to go to Whole Foods and get a salad, I have the accountability with my provider. It's not just I get sick and then I go to the hospital and they fix me up and then I go back out and live my current lifestyle and get sick again.
Dr. Wilcox, let me say it this way. You wrote a book on how to navigate the current system. You're earning your money legitimately in giving a worthwhile service. The system exists today as it exists. And as it exists today, we need somebody to tell us or help us navigate the system. You are worthy. You are worthy.
Well, thank you. I appreciate that.
Let me finish. But you are worthy. Okay. What the part that I don't understand with somebody like yourself and others that I've spoken to on this issue, I think this sort of a profit motive within the healthcare system, or I guess it's the kind of economy that we have in the United States, is so inculcated in our minds that we don't see sometimes the other side. And I want to query you and just ask you a couple of things. And you work so hard to navigate this system. The shareholders who hold the hospitals, the shareholders who hold the doctors hostage, all these guys, they're not like you, doctor.
No, they're not.
Okay, and that is a profit motive that I'm talking about. Also, you spoke about, the doctors are incentivized. Yeah, they get a good salary, and I want them to get a good salary. My sister's a doctor. My daughter, who just had 2 strokes, is working on her boards right now to be a doctor. I mean, so I am all for that. I just want or hope that we will see more people of your caliber, because you know how the system works. Tell people like it is, like, hey, those shareholders didn't do a damn thing for,
That's right.
Most drugs are developed at universities or grants that are given from the NIH, and when their viability shows up, then the shareholders come in and say, oh yeah, we'll invest in that now because we see the viability.
Right.
Those are the kinds of things I want to mitigate. But I think it's people like you that have to, I think you can do a better job than I can in putting that message out.
Yes, definitely. Definitely. So in the healthcare realm, we're called disruptors because we're not going to sit back and watch this happen anymore. So have you followed Mark Cuban's generic pharmaceutical online company at all?
No, I have not.
Okay, so this is a guy from Shark Tank, right?
I know who he is, yeah.
Okay, so he started an online generic pharmaceutical company to lower costs by huge amounts. Because what people don't know is, you think a doctor writes you a prescription, you go get it filled, and it's a transaction between the doctor, yourself, and the pharmacist, right?
There's that middleman, PMBs.
Yes, pharmacy benefit managers.
Mm-hmm.
So what Mark Cuban has done is he said, I'm not playing with the pharmacy benefit managers. I'm not going to support that role because they will charge you the price of admission to the insurance companies. And so what he does is he goes directly to the drug manufacturer, buys the drug for as cheap as he can, sells it for a 15% markup to keep his business sustainable.
Yeah.
And he said he could make so much more money if he just played ball with these guys, but that's not what it's about. So, and then there's like another 5% or something to ship it to you. But that kind of disruption makes the pharmaceutical companies,
I didn't know about that. I didn't know about that at all. I'm going to look that up because, and see, and anybody can use his services.
Yes, as long as you have a prescription called in, and he's got a warehouse actually in Texas. Mm-hmm. So he's got a warehouse.
Well, he's from
Texas.
Dallas, yeah.
Yeah, so he plans on expanding this model. So, why would you, it's cheaper than having insurance, which makes you start to wonder, Medicare Part D, do I really need it if I can get my drugs at, dirt cheap from his site? So it has a tendency to rock the boat in so many directions. I mean, right. GoodRx was one of the initial ones that did it. But he's just doing it to help people. And that's what we need more of. We need more care in healthcare. we don't, you know, healthcare has become, like you said, a business. It's profit driven. They've got shareholders. They've got to make a certain amount of money. But what happened to the care? What happens to the poor guy that goes into the emergency department? He has congestive heart failure. He gets his prescriptions. He goes to the pharmacy and he tries to fill them, and they tell him it's going to be $250. He opens his wallet and he's got a 20, right? Mm-hmm. He can't get those drugs. So he leaves and he goes back because they fixed him at the hospital, and he gets sick again within the next 30 days or so. And he's right back in the emergency department, and it's a vicious cycle. I've even heard of a pilot program where, because hospitals started to get dinged, we talk about profit, because if somebody had been there within 30 days and came back for the same condition, they weren't going to get paid for it for certain conditions. They just gave people 30 days worth of medication because it was cheaper to just give them the drugs, right? And then they don't come back, and then the hospital doesn't get dinged. So yeah, unfortunately, it really does come down to the money motivation. I mean, we could talk about one of the big healthcare insurers that's actually insuring the Medicaid population in Arizona. Went out, they found the people that were costing them greater than $50,000 a year in costs, bought an apartment complex for these homeless individuals and said, hey, we will give you an apartment. We'll give you access to a nurse practitioner for 4 hours a day. You have to stay out of the hospital, quit going to the ED, quit becoming an inpatient, and we will take care of you. And if you can do that, we'll help you get signed up for SSI. And so they returned investment to their shareholders in a very humane way, but it was all driven by the dollars, because the guy who was doing the right thing and not accessing the system, he didn't get any of that benefit, right? Nothing. So.
Well, let me tell you, Dr. Wilcox, my last question always say, where have I erred? What would you have liked me to ask you? Well, I want to do this, but beforehand, I want to do a 1 minute monologue and say, first of all, thank you for appearing on the show. Thank you for writing the book, because I think that people have to learn how to navigate the system as it is today, not necessarily how an idealist like me would want it to be, or a more pragmatic person like you would want it to be. You have to be able to look at the system the way it is today. So I thank you for the book. I have one request for you in the future, given that you know the ins and outs of how the system works, that you consider some of the ways that I think that says, let's get the damn profit from shareholders and all those crazy bonuses out of the system. How maybe write a book on how can we transition to that. So that's my 1 minute spill with you. But please, sir, what didn't I ask you that you would have liked me to ask you?
Sure. So the one thing I would like everybody to hear is, don't access the healthcare system without knowing about the healthcare system. You'll get hurt. Happens all the time. I've seen it happen all the time. We have a nurse from Vanderbilt that's just recently went to trial for a med error. I mean, it's the first time we've seen a nurse do that before. And we could definitely do a show on that, because that's crazy. But my point is, proactively educate yourself with viable, good materials. And that's why I wrote this book, was so that people could proactively educate themselves, so they knew how to behave in a healthcare system and how to partner in their care. For instance, if somebody rushes in to give you meds, you make sure they tell you what each medication does and cross-references with what you take at home, because people have gotten hurt in rushed medication scenarios. So do your research. Just please do your research so that you can be safe, and we can have a beer together someday.
Dr. David Wilcox, author of the book, How to Avoid Being a Victim of the American Healthcare System, a Patient's Handbook for Survival. Thank you so kindly for having been on Politics Done Right.
Thank you. Thank you for having me. I appreciate it.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number one, subscribe to our channel. And number two, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.